Okay, we are good to go. Good morning. I hope you're well today. And today we're going to be looking at the key health priorities here in Ireland. We are going to be looking at the major chronic diseases in Ireland, and in particular, the risk factors that are driving those chronic diseases as a basis to our health priorities. Let's first have a look at Ireland at the moment. Life expectancy has been increasing steady in Ireland since 2006. The greatest gains in life expectancy have been achieved in the older age category, reflecting a decrease in mortality rate for major diseases. Life expectancy in Ireland is above the European Union average. And when you take into account Ireland's high GDP, paints a very positive picture in Ireland. However, there is an increasing disease burden here in Ireland. Irish people are living longer lives. However, the incidence of chronic disease is rising, and so too is our drug budget. So people are living longer lives, but also living sicker. Lower socioeconomic areas have been the worst hit with chronic disease, especially the traveling community and areas of deprivation. If we look at the mortality rates from two of our biggest chronic diseases, circulatory system diseases have decreased 31% since 2017, and cancer death rates have decreased also. Importantly, though, the incidence of these diseases has not reduced. So the prevalence of chronic disease in the population continues to increase due to a reduction in mortality from chronic diseases, but also due to increasing incidence of chronic diseases in the population. Here we see the leading causes of death with circulatory diseases and malignant neoplasms top of that list. And as we can see, the rates of the major chronic diseases in Ireland tend to manifest more so in the older age categories. However, we know from the science that they tend to begin in as young as childhood and develop throughout the lifespan. We can see from this stat that the rate per 1,000 in the population of death is slightly higher in males. Now, if we look at the leading chronic diseases here in Ireland, we can see that ischemic heart disease, lung cancer, COPD, lower respiratory infection, and Alzheimer's disease are the leading chronic diseases in Ireland. If we dig a little bit deeper in that same data from the Global Burden of Disease, we can see that the risk factors that are driving this disease is tobacco, high blood pressure, high body mass index, dietary risks, and high fasting plasma glucose. We can see in particular high body mass index has had a sharp rise of 18% since 2009 as a risk factor, and high fasting plasma glucose has had an even sharper rise of 65% as a risk factor since 2009. So if we look at high blood pressure in Ireland, we know that 60% of people aged 45 years and older had high blood pressure when the study was conducted in 2018, and this number is increasing. The majority of men and women with high blood pressure are not being treated in Ireland, and that's a major concern. If we look at another one of the risk factors of high BMI, we can see that this data from 2015, which shows that 55% of Irish men and 38% of Irish women are overweight or obese in 2015. However, if we look at more recent data from the World Health Organization, we can see that 1/4 of adults are obese, and a total of 61% of adults are overweight or obese, with 66% of them being men and 55% women. We also know from data across the globe that the prevalence of overweight and obesity in children and adolescents has starkly risen over the last number of decades. There is a little bit of a gap in the data for diabetes here in Ireland, but we do know that over 200,000 Irish people are living with type 2 diabetes, and we know that it's a disease on the rise here in Ireland. It's also estimated that over 100,000 people are living with undetected diabetes here in Ireland. We know that this is a disease on the rise, and we know that a high fasting blood glucose is the leading risk factor for type 2 diabetes in the world. So if we look back at the 5 risk factors for developing chronic disease, they would form the basis of our 5 key health priorities here in Ireland. So we know to reduce the prevalence of disease, we must target the 5 known risk factors for disease. And if we look a little bit closer at those risk factors, we can see that all of them are related to diet and lifestyle choices. And in fact, poor diet is associated with 4 out of the top 5 risk factors for chronic disease in Ireland. So that'll form the basis for our priorities here. Chronic disease rates can best be lowered by targeting improving diet and lifestyle at a population level. And if we take fibre as a means to improving diet in Ireland, we know that fibre can improve high blood pressure, we know it can improve high BMI, and we know it can improve high fasting blood glucose. How are we doing with fibre here in Ireland? Well, it's recommended in Ireland that Irish people get at least 24 to 35 grams of fibre a day. However, 78% of Irish people are not hitting even 18 grams of fibre, and very worryingly, 37% aren't even getting a minimum of 12 grams of fibre per day, which shows a real worry in dietary habit patterns here in Ireland. We know that many studies have found that people on diets high in fibre have reduced risk of certain diseases, and these are our major diseases such as cancer, coronary heart disease, obesity, and possibly diabetes. And this is done by reducing the underlying risk factors of these diseases. We know that increasing consumption of diet fibre is a critical step in stemming the epidemic of obesity found in developed countries. This priority on diet and lifestyle is very much reflected by the HSE of Ireland's national policy priority programs. And they indeed identify that our greatest challenge is changing lifestyle behaviours in Ireland, with smoking and dietary factors being our key targets. So in conclusion, tackling the leading risk factors of disease can help lower the burden of these diseases and chronic disease rates in Ireland. By increasing fibre consumption at a population level, we can target 4 of the top 5 risk factors for chronic disease. Who is our target population? Our target population is the large majority of people who are failing to consume the recommended 24 grams of fibre per day. And our key target would be to get that population up to 24 grams of fibre per day. Thank you for your time. I appreciate it.